This video is created by Barends Psychology Practice. In the next few minutes, we'll help you interpret your bipolar disorder test results. Our goal is to give you a clear and supportive explanation of what your scores may mean, and what steps you can take next. After submitting your answers, your total score should appear just above this video, along with your scores for the subcategories, Depressive episode, and Manic episode. First, we looked at symptoms of a manic episode. If your score on the manic symptoms section was below 3, it means you likely do not experience enough symptoms to meet the clinical threshold for mania. If your score was 3 or higher, the symptoms may indicate a manic episode, but there's a small catch. If you experienced only elevated mood or increased energy, but not both, you'd need at least 4 symptoms to qualify. Now, based on your total manic episode score, your results fall into one of several categories. If your score was below 20, your symptoms likely don't interfere with daily functioning. If you scored between 20 and 49, the symptoms may be causing mild impairment, but they may also stem from medication, drug use, or medical treatment. It's a good idea to contact a mental health professional. A score between 70 and 99 suggests significant symptoms, but they likely lasted less than 3 days and didn't require hospitalization. This means you don't meet the full criteria for mania or hypomania, yet it's worth discussing with your doctor. Scores between 100 and 119 point to symptoms lasting 4 to 6 days, possibly indicating hypomania, but without severe impact on your daily life. Again, a consultation is recommended. If your score falls between 120 and 149, symptoms lasted 4 to 6 days and made it hard to function. These could still be linked to medication or drug effects, but they're serious enough to speak with a professional. A score of 150 to 169 suggests a hypomanic episode, where symptoms disrupted daily life and are not better explained by substances or medication. We recommend seeing a psychiatrist or your GP. Finally, if your score was 170 or above, you likely meet the criteria for a manic episode. This may include hospitalization, severe disruption in functioning, or symptoms lasting more than 6 days. Please contact a psychiatrist or your GP as soon as possible. Now let's look at the depressive episode score. If your score is below 104, you likely don't meet the threshold for a depressive episode. But if your score is 104 or higher, and you also scored at least 50 points on the depressive episode section, the symptoms are likely impacting your life in some way. A score below 50 means you may feel down but are still managing daily responsibilities. Still, reaching out to a therapist is advised if you're struggling. If your score is between 50 and 69, symptoms are more severe and likely interfering with daily life, although they may still be explained by drug use or medication. A score of 70 or more means your symptoms are serious, lasting over 2 weeks, and cannot be explained by substance use. We strongly recommend speaking with a therapist or mental health professional. Final note: this test is not a diagnosis, but it's a valuable step toward understanding your symptoms. If your scores suggest moderate to severe issues, don't wait. Help is available, and early intervention can make all the difference. Thank you for taking the test. Take care of yourself. If you found this video helpful, please give it a like and consider subscribing to our channel for more mental health resources and tools. And if you have any questions, feel free to leave a comment. We're here to help.